Dear participants, it's a great pleasure also for me to welcome you to this Info Day on the Horizon Europe Health Cluster. So my name is Irene Norstedt and I am the Director of the People and Society Directorate at DG Research and Innovation. The Health Cluster, or Health Program as we call it, is the shared responsibility of 4 Commission DGs who are working closely together to deliver the health work programs. I would like to welcome my colleagues Marco Marcella from DG Santé, Christiane Kirke-Terpte-Firon from DG Connect, and Laurent Michel from DG HERA. My colleagues will also be addressing you in a moment. So let me start by saying a few words about what you can expect from this Info Day. The purpose of this event is to present you with the 2025 work program of the Health Cluster and the rationale behind it. You will also be given an introduction to the research and innovation topics in the work program, as well as the opportunity to ask questions in dedicated question and answer sessions. Sessions on cross-cutting issues relevant for all applicants will also be made available to you. The 2025 work program was published about a month ago on the European Commission's Funding and Tenders portal. Today's event will focus on its calls and topics, which open today, the 22nd of May. The deadline for submitting proposals to the 2025 call is on the 16th of September 2025, and for single-stage topics and for the first stage of the two-stage topics. The deadline for the second stage of the two-stage topics is on the 16th of April 2026. The results of the call are expected by the end of January 2026 for single-stage topics and for the first stage of the two-stage topics, and by the end of July 2026 for the second stage of the two-stage topics. The 2025 work program is the first under Horizon Europe's second strategic plan, covering the years 2025 to 2027. This one-year work program is divided into 6 chapters or destinations that aim to deliver specific health-related impacts. The program is designed to address research and innovation needs identified in the strategic plan that were not covered in the first 4 years of Horizon Europe. The work program also aligns with the European Commission's key priorities for 2024 to 2029. And that includes the improvement and preventive healthcare, making our healthcare systems more resilient, harnessing the power of biotechnology and artificial intelligence, addressing pressing public health needs, and staying prepared for the future pandemics. As a successful applicant to our calls, your project will help implement the Horizon Europe strategic plan and the European Commission's priorities by delivering solutions to health challenges that benefit citizens in Europe and globally. Let me now give you a brief overview of the work program 2025. Destination 1 focuses on helping people of all ages staying healthy, resilient, and independent. In Work Programme 25, we focus on individuals with intellectual disabilities and their families. We are looking for innovative interventions and medical technologies and digital solutions to improve their quality of life. Destination 2 aims to reduce exposure to pollution and creating healthy living and working environments. In this program, focus is on investigating the impact of pollution on brain disease and disorders, and advancing knowledge on the impacts of micro and nanoplastics on human health. Destination 3 of the work program addresses gaps in our current treatments for non-communicable diseases, and here we are focusing on innovative interventions for mental, behavioral, and neurodevelopment disorders, and on under-researched high-burden medical conditions, and on improving health care for non-communicable diseases with a focus on equitable care for disadvantaged populations. Destination 3 also addresses the need for research and innovation to prevent future pandemics and emerging infectious diseases, including antimicrobial resistance. My colleague from HERA will give you further information on this point in a moment. Destination 4 of the work program aims to improve our healthcare systems, making them more efficient, sustainable, and equitable. In 2025, the focus will be on user-driven generative AI intelligence models for healthcare to improve patient outcomes. And Destination 5 of the work program explores the potential of new health technologies with several topics of interest also to small and medium-sized companies. Topics in 2025 focus on making cell therapies more accessible by overcoming production challenges, advancing the development of cell secretome-based therapies, which have shown great promise in regenerative medicine. Also using multimodal data to improve generative AI in biomedical research. And finally, on boosting the translation of biotech research into innovative health therapies. This last topic specifically aims to support small and medium-sized companies. It is part of the Strategic Technologies for Europe platform initiative, which aims to boost investments in critical technologies in Europe. Finally, Destination 6 of the work program aims to stimulate the European health industry. In 2025, this will involve optimizing the manufacturing of advanced therapy medicinal products, the ATMPs, digitizing conformity assessment procedures for medical devices and in vitro diagnostic medical devices, and facilitating multinational clinical studies for orphan and breakthrough devices. I hope this brief introduction to the Work Program 2025 was useful for you, and I now have the pleasure of giving the floor to my colleague Marco Marcella, who will give you DG Santé's perspective on the Work Program. Thank you for your attention.
Thank you, Irene. I am Marco Marcella, Director for Digital, EU for Health and Health System Modernization in the DG for Health and Food Safety, and I am delighted to speak to you today. Over the past 4 years, our teams have worked closely together to connect. We are also stepping up our efforts on cardiovascular diseases, the leading cause of premature death in Europe, building on the European Beating Cancer Plan. To achieve this ambitious goal, we have several instruments to support us, and among them is the EU for Health Policy Programme and the Health Cluster under the Horizon Europe programme. These programs share common priorities. They complement each other. Among them, there is digital health, including artificial intelligence, crisis preparedness, health promotion, and disease prevention, mental health, and many more. And as new health threats and challenges emerge, we must continue to make healthcare systems more inclusive, accessible, sustainable, and resilient through health policy and through health research. Let me now briefly introduce some actions in the Horizon Europe Cluster 1 Work Programme 2025 that directly contribute to the common health priority I just mentioned. For example, let me highlight the two actions under Destination 6. One is related to digitizations of conformity assessment procedures for medical device and in vitro diagnostic medical device. This action will reduce the administrative burden and facilitate the conformity assessment procedure for manufacturers, and in particular for small and medium enterprises. Another important step we are taking is to making it easier to carry out multinational clinical studies for orphan and breakthrough medical devices. This is key to filling the gap we currently see in getting innovative devices to patients with rare conditions or unmet medical needs. There are lots of opportunities and synergies between EU for Health and the Horizon Europe Health Cluster. The aim is to facilitate the diffusion of knowledge, leverage collaboration, and ultimately benefit Europe's healthcare sector and healthcare systems. These two programs open up many opportunities to work together across important areas like non-communicable diseases, pandemic preparedness, antimicrobial resistance, modernizing health systems, and digital health. Let me give you a concrete example. To help bring the European health data space to life, we can take insights from European Horizon projects that focus on cross-border data use and use these results to guide actions under EU for Health, actions that are aimed at moving the data space forward. I encourage you to have a look at both funding programs and their work programs and find what opportunities are there. Thank you very much. And now I give the floor to my colleague, Christiane.
Thank you, Marco. So my name is Christiane Kirketorp de Viron, and I lead the directorate in DG Connect in charge of digital society, trust, and cybersecurity. I represent the co-chair for digital policies in the health cluster. The EU is committed to fostering a secure, safe, and sustainable digital transformation in line with our core values and fundamental rights. In the health sector, digital solutions can deliver triple win for Europe by improving the quality of life for European citizens, supporting long-term sustainability of health system, and thirdly, by enhancing competitiveness of our industry. The positive impact of digital transformation of health services can be seen across the whole care pathway, from healthy living to prevention and early detection to treatment and follow-up of diseases. We have recently been witnessing rapid advances in the field of AI, also in health. The EU aims to ensure that AI is safe and trustworthy and complies with European values and rules. To boost competitiveness, the Commission has also launched several initiatives supporting AI startups and SMEs in the development and deployment of trustworthy AI. AI factories bring together the key ingredients necessary for AI innovation: computing power, data, and talent. They foster collaboration across Europe, linking universities, supercomputing centers, industry, and financial actors. The AI factories will facilitate access of innovators and researchers to European supercomputers to develop better performing and more trustworthy AI models. AI factories also leverage the supercomputing capacities of the Euro-HPC joint undertaking for innovators and researchers to develop trustworthy, cutting-edge generative AI models. The Gen AI for EU initiative aims to support the development of novel use cases and emerging applications of generative AI in Europe's 14 industrial ecosystems as well as the public sector. Healthcare and life sciences are among the most impactful sectors where generative AI is expected to really foster innovation. The Apply AI strategy will boost new industrial uses of AI in strategic sectors such as healthcare and pharma. It will support the development of world-class AI models in the EU to accelerate innovation and enable European countries to be global frontrunners in AI development and application. So far, we have 13 AI factories that have been selected for implementation across the EU. 10 of these will be optimized for the application of AI in health and life sciences. Now I would like to briefly introduce two actions in the Horizon Europe Cluster 1 work program for 25 that directly contribute to the AI initiatives I just mentioned. They focus on leveraging generative AI in healthcare and biomedical research. The action under Destination 4 deals with the end-user-driven applications of Gen AI models in healthcare. Gen AI solutions developed under this topic will bring benefits for patients through better access to health information and more personalized care, for healthcare professionals through innovative user-centric virtual assistant solutions, and of course for healthcare systems through improved cost-effectiveness and standards of care. The second action under Destination 5 is about leveraging multimodal data to advance the use of Gen AI in biomedical research. This action will foster the development and testing of generative AI models and methodologies to support predictive and personalized medicine. An important requirement for both topics is to develop trustworthy tools and models. In other words, they must be robust, safe, ethical, and explainable. The development of Gen AI solutions under both topics will be supported by existing EU digital health infrastructures, including our AI factories. These infrastructures provide a strong foundation for healthcare innovators and researchers to build on, bringing together high-quality data and computing capacity for Gen AI. Thank you for your attention. I would now like to give the floor to my colleague Laurent from DG HERA.
Thank you, Christiane. Hello, everyone. My name is Laurent Michel, and I'm the director of HERA, the European Health Emergency and Preparedness Response Authority. HERA was created in September 2021, building on the lessons learned from the COVID-19 pandemic. The mission of HERA is to strengthen the ability of the EU and its member states to prevent, detect, and rapidly respond to cross-border health emergencies. Our mission is to ensure that key medical countermeasures are available and accessible. In order to do so, we look at the whole value chain, starting from intelligence gathering functions, support to research, innovation and development, all the way to distribution and stockpiling, including through procurement of medical countermeasures. With COVID-19, we all realize the importance of supporting research to increase the knowledge of the virus, help contain the spread of the pandemic, and facilitate the cure. Yet, the next health threat is already knocking at the door, and the Commission is working on different fronts to ensure that we are better prepared and able to react quickly. During the preparedness phase, HERA is tasked to monitor potential threats, collect intelligence, and develop preparedness and response actions, including research and development for medical countermeasures. In this context, the promotion of research is crucial to accelerate the development of diagnostics, vaccine, and therapeutics. HERA has identified three main categories of threats. The first includes virus with high pandemic potential, such as Lassa or Nipah virus, to name some examples. But of course, avian influenza is particularly high on our agenda at the moment. The second category covers chemical, biological, radiological, and nuclear threat, cyber threat. And the third category is represented by antimicrobial resistance. And how do we properly support research and innovation for pandemic preparedness? To do so, HERA can count on Horizon Europe. HERA is one of the 4 co-chairs of Cluster 1 and fully involved in the co-creation process. Over the period 2022-2027, the budget earmarked for HERA is 1.7 billion euros. For 2025, the amount earmarked is 222 million euros. Under this budget, we have co-developed topics under Cluster 1 that aim to lay the foundation for the development of innovative solutions for prevention, diagnostics, and treatment of pathogens with pandemic or epidemic potential. Viral disease emergence is expected to accelerate due to, among other, climate change, and thus a proactive approach to the development of antiviral prophylactics and therapeutics is needed. In 2025, HERA will support projects aiming to develop antibodies and antibody-derived proteins for the prevention and treatment of infection disease with epidemic potential. In that context, AI should be used for improving preparedness and response to epidemic and pandemics. Therefore, HERA will also support the leveraging of artificial intelligence for pandemic preparedness and response. Antimicrobial resistance, which is also widely considered as a silent pandemic, is on the increase due to the number of bacteria resistant to antibiotic treatment. We are facing a major gap in the discovery of innovative antibacterial treatments. Bacteriophage represents a promising alternative or complement to antibiotics when infections do not respond to conventional treatment options. HERA will support the safety and efficacy testing of phage therapy for the treatment of antibiotic-resistant bacterial infections. Global cooperation is also of particular importance for pandemic preparedness. Hence, ERA supports the work done by the Global Research Collaboration for Infection Disease Preparedness, GLOPID-R, to coordinate the work of funders to ensure a timely, effective research response. All in all, we need to further encourage investment in pandemic preparedness. The COVID-19 pandemic has changed history. Investing in pandemic preparedness and resilience is not a mere expense. It's a real investment that pays off. Equally, we need to support global effort to maximize impact and promote a broad, holistic approach, especially by developing synergy across different Horizon Europe clusters and other funding programs. In this context, Cluster 1 provides a significant contribution to promoting innovation for being prepared and able to prevent and quickly respond to any outbreak in the future. As you know, in December 2024, the new Commission took office. One of the priorities for this Commission is preparedness and crisis management by applying a comprehensive and integrated
program for 2025. In a moment, we will have presentations by the co-chairs for the Horizon Europe Health Cluster, who represents the 4 Directorates General that oversee this part of the framework program, on the policy basis, rationale, and the objectives of the 2025 work program. This will be followed by a question and answer session on the cross-cutting aspects of this year's funding opportunities. Then we will have presentations from the national contact points, the NCPs, on the support they can provide to applicants. And finally, we will have a series of question and answer sessions for each of the 6 destinations of the health cluster, which will cover all the topics of the work program 2025. Please remember that you can send in your questions via Slido. But first, I propose to give you a quick introduction to the Health and Digital Executive Agency, or HADEA. I will present the agency and its role in supporting the European Commission in implementing the Horizon Europe Health Cluster and other programs. The European Health and Digital Executive Agency, or HADEA, was established by the European Commission and is operational since April 2021. Executive agencies, like HADEA, are set up and supported by the European Commission to implement direct funding programs on its behalf. HADEA also manages ongoing projects launched through earlier programs such as Horizon 2020. HADEA implements specific funding programs related to health, food safety, digital, industry and space from the EU budget of 2021 to 2027, with a total of almost 20 billion under its responsibility over that period. These are the programs that are implemented by the agency, with the corresponding budgets. As you can see, just over half is dedicated to health. First, through the EU for Health program, which has a budget of 3.8 billion, and secondly, through the health cluster of Horizon Europe, with 5.6 billion over 7 years, as well as the EU mission on cancer. I would like now to outline how these executive agencies work with the Commission. In other words, who does what? In short, one can say that the European Commission defines policy while the executive agencies turn this policy into action. So the Commission, in consultation with the Member States, defines the strategy and the priorities for each cluster, and ultimately translates this into the annual work programs with the topics published in the calls for the proposals. The Commission also makes key program decisions, including, for instance, approving the choice of experts identified by the agency for the evaluations, and selecting the projects to be funded, based on the evaluation of proposals by independent experts, under the supervision of the agency. And of course, the Commission oversees and assesses the work and performance of the agency. In complement, the role of the executive agencies is to implement the work program. In practice, for HADEA, this means publishing the calls for proposals for Horizon Europe, organizing the evaluations by independent experts, preparing the grant agreements for the shortlisted proposals, and monitoring the projects throughout their life cycle. The agencies also support communication activities and provide feedback for policy making. At HADEA, in the case of the Horizon Europe Health Cluster, we report to 4 Directorates General of the European Commission: DG Research and Innovation, DG Connect, DG Santé, dealing with health and food safety, and DG HERA, the European Health Emergency Preparedness and Response Authority. This is the portfolio of health research projects monitored by the agency. So far, there are 476 Horizon Europe projects now ongoing or soon to start for the health cluster and the cancer mission. These stem from the first 4 years of Horizon Europe calls for proposals. The vast majority of these are research and innovation actions with an average grant size of around 8 million euros. In addition, HADEA monitors 247 ongoing health research projects from the earlier Horizon 2020 program. I would like to conclude with an overview of the schedule of 2025 calls for proposals of the health cluster. Work Programme 2025 was published in April. The deadline for most topics is 16th of September, the exception being the 2 partnership topics, which have their deadline on 3rd of June. These will be evaluated soon after in July, with results expected to be ready later in July. However, for all other topics, the evaluations will span from approximately mid-October to mid-December, and we expect to announce the results by the end of January. Some topics will have a 2-stage submission and evaluation process, with the second deadline foreseen on 16th of April 2026. Thank you for your attention. Please stay informed of developments at HADEA, and my best wishes for your endeavors to apply for EU research funding.
Good morning from Brussels. My name is Harriette van Eyl and I work for the European Commission DG Research. A very, very warm welcome on behalf of all the colleagues here in the European Commission to this Info Day. Really appreciate that you take the time to be with us and to be with us for the whole day. So today we have a full agenda with you, for you. With a lot of opportunities to share your questions, and we hope to answer all of them in the coming hours. We have a day that is set up in a number of sessions, and traditionally we start with a cross-cutting session, so questions that are cross-cutting the whole of the program, that deal with international cooperation, with how you form consortia, who is eligible, who is not. And although we are now in the 5th year of Horizon Europe, there are always some new things and novelties. So this session deals with that. And then we will have extensive time for Q&As for the different destinations. So I fully encourage you to join us with Slido. We have a great team here that will assign these questions, and we hope to answer these both here in the cross-cutting issues but also in the destinations. Now, in the cross-cutting issues, we have a great team with me today because cross-cutting issues deal with many different types of issues, and for that I am really happy that we have a fantastic all-female panel with us today. And I would like to invite Rosanna Damario to first introduce herself, and then I will go to our panelists online. So Rosanna, floor is over to you.
Good morning to all the people who are connected to this Info Day. So my name is Rosanna Damario. I work in the unit of Henriette in the Research and Innovation Directorate General. And I'm here this morning to answer to possible questions about social sciences and humanities integration, SSH integration. Thank you.
Excellent. So I would like to hand over to Isabella. Isabella, please, could you introduce yourself?
Thank you very much for the floor. My name is Isabela Prokopovic. I am a policy officer also at the Director General for Research and Innovation, and I will be here today answering your questions on blind evaluation, and looking forward to the session. Thank you.
Many thanks, Isabella, for being here, because we will have 5 topics in the work program 2025 that are both two-stage and blind evaluation. So many thanks to be here to answer all those questions. Then I would like to hand over to Lorna. Lorna, please.
Good morning, everybody. I'm Lorna Schreffler. I'm a policy officer leading the team on international cooperation in the work program. And I'm here to answer your questions on international cooperation and looking forward. Thank you.
Yeah, thank you, Lorna, also for being here, because we've seen that you already have posed many questions about US participation. So we will handle those questions in the coming hour or so. So then over to Andrea, please.
Thank you, and good morning, everyone. My name is Andrea Kikos. I'm working at DG Research and Innovation. I'm a policy officer in Unit H3, where I'm dealing with simplification. So I'm here to answer your questions on lump sum funding.
Excellent, many thanks. Then over to Hannah, please.
Thank you very much, Henriette. Hello, everyone, and I'm happy to be here with you. I am policy officer in Unit for Democracy, Equality and Culture in Gender Sector, and I'm here to answer your questions on gender equality.
Excellent, very important as well. So, and then finally to Adina. Adina, please, Maya.
Good morning, everyone. I'm Adina Retsoy. I'm a co-coordinator at the Health and Digital Executive Agency, and I'm obviously dealing with evaluation. So any questions on that, I'll be happy to take. Thank you.
Yeah, many thanks. And Adina and her team at the agency are responsible for all the evaluations and also the project management, as her colleague Stefan mentioned. So it's great that you can be here today as well. So I already see that we have a first question on the screen on SSH flagged topics. So maybe, Rosanna, SSH flagged topics may attract the participation of SSH scientists. What about non-SSH flagged topics? Can they also foresee SSH scientists in the consortium?
Yeah, thank you, Henriette, for this question that is very relevant. And indeed, as people may have seen, more than half of the topics in the work program 25 of cluster 1 are SSH flagged. So it means that they may take advantage of the inclusion of scientists. Of course, they are particularly welcome. So yes, the answer is yes. Thank you.
Many thanks, Rosanna. So we're going to move very quickly through all these questions. So I hope we can get the second question. And otherwise, I have a few that you have already submitted to me. So maybe while we're waiting, many of you asked about lump sum. So all topics where lump sum is not clearly mentioned are supposed to be unit costs. So I think this is for Andrea, please.
Yes, thank you. Indeed, if you have a lump sum topic, this will be specified on the topic page, so on the topic description. You'll also see it at the top of the topic page is the type of MGA, and you will find it there, Horizon Lump Sum Grant, or as an acronym, Horizon AGLS. If you don't have this mention, your topic will be a standard one, and the standard one is actual cost, so not unit cost. Maybe this was a confusion. So yeah, I think this is the short answer.
Yeah, so great advice, Andrea. Really check lump sum or not lump sum. If it's not a lump sum, it's a normal tradition, a traditional topic. So how can we know if there's any restriction on the participation of a non-EU member states? And how can we know if a country is eligible? And I think this one is for Lorna. Would you like to come in, Lorna?
Yes.
Yeah.
Yes. Can you hear me? Yes.
Yes.
Yes. As you know, in principle, the work program is open to international cooperation, and where there are specific restrictions, this is actually specified in the call topic. In addition, entities because of the ongoing and applicable sanction packages, entities from Russia, Belarus, and the non-government controlled territories of Ukraine are not eligible to participate in any capacity to the program. This is specified in the general annexes. But for the rest, as you know, international cooperation is welcome with the partners, also from third countries and non-associated countries.
Thank you very much, Lorna. And indeed, in health research, you've had a very long tradition of successful international cooperation. Good. You're moving to the next question. So I'm searching for collaboration and funding for my project. It is project overview titled Reduced Antibiotic Use in COPD Exacerbations, a randomized crossover trial. So this is quite a specific question, but it's a very important question because it's about partner search. I'm just checking if anyone of the panel would be able to answer that, because there is a partner search facility on the Horizon Europe portal, and also your national contact points often organize brokerages and brokerage events where you can partner up with other potential partners. So check out our Horizon Europe portal, and also please contact your national contact point. They will be very happy to help you with that. So over to the next question. My cough. The management of European projects is quite complex and time-consuming. Some companies are specialized in the project management. Could they be partners? Maybe over to Adina.
Indeed. It is possible to have partners that can help you with this type of task, a project management task. However, if you are a coordinator of the project, you have to check quite in detail the grant agreement, the model grant agreement that is published in the portal. And there you will see that there are specific articles that will tell you whether you can subcontract or not specific tasks of the project. So in general, project management, if you are a project coordinator, cannot be subcontracted or cannot be delegated, but there are specific conditions where such partners can be part of the consortium, either as affiliated entities or any other type of partner. So please check the model grant agreement, check the article, in particular Article 7, but also other articles, and then have a little bit more information on that. Also, don't forget that you can contact your national contact point and have this type of questions also addressed to your national contact point, who can help you with that. Thank you.
Many thanks. Great advice, national contact point, and check out the model grant agreement. We have another question for you, Rosanna. In terms of SSH, we have thought of including ethical considerations in our project and wanted to confirm this would be a good contribution, or do you have other ideas?
Yes, of course, when we talk about SSH disciplines, we refer to all possible SSH areas, so including ethical research. But yes, we have to distinguish what is the ethical research that may it doesn't mean that one excludes the other, because in the same project there may be both aspects, so research on ethics, but also ethical requirements that comply with the description of the topic. Thank you.
And thank you for making that distinction as well. Thank you. And for raising that, the importance of ethics in all our research programs. So the next question is already there. When building consortium, can the main part of the budget go to one of the associated countries while the coordinator still be in Europe? I'm looking at Lorna or at Adina, or Who would like to go first?
Perhaps.
Yeah.
I mean, maybe I'll let Adina comment on the share of the budget, but there is, in principle, no restrictions on how you want to combine the consortium and the different roles between associated and based in Europe, provided I understood the question correctly.
If I may just complement what Lorna said, if there are partners that would like to join as associated partners, they cannot request EU funding. However, of course, they need to have the funding themselves to be able to carry out the project activities. And there is a specific column in the budget table, in the Part A of the proposal, where they need to declare the fact that they have this kind of budget and they need to include it. However, they cannot request EU funding if they participate as associated partners.
Mm-hmm. So what I really hear from you, Adina and Lorna, is first check what is the situation in your country. Is your country in a category? Are you based in a country that is eligible for EU funding? Yes or no? And then also look for a consortium that has the minimum number of partners from an EU associated country or from the EU 27. Yeah? So those are the two steps that you will need to take. And great that you would like to that you're building a consortium. Fantastic. Next question. Okay, now we're going to the USA questions. So is USA eligible for funding in the same way as any other EU country? And could an eligible consortium be established with EU countries plus USA? And I think you mean an organization that is based in the USA. So a research organization or a company that is based in the USA. So Lorna, here we go.
Yeah. So, as you have seen and you probably noticed, there's a number of topics in the Work Program 25 for the health cluster that specifies that US-based entities are eligible for funding. So in that specific case and for that specific topics where this is indicated, this is indeed the case. So we confirm that this is applicable. For the topics where this is not indicated, I mean, you will find all the details, of course, in the guidance for Horizon Europe, but the USA is not a low and middle income country. So normally for the other topics where the funding of US entities is not specified, normally they have to bring their own funding. That said, there have been exceptions in the past where the consortium argued quite well that it was essential to have the participation of the US entity, either because it gave access to specific data or specific infrastructure or had a unique capacity that couldn't be replaced in any other way. And you can argue, try and argue this in the consortium. But the safe way is to assume that this is always the case where this is specified in the call topics, and for the others to assume that they have to bring their own funding.
Yeah, excellent. So we do want to encourage cooperation with USA-based entities. Now, there's one other advice that I would like to give to you, and it is check that your USA organization is allowed to participate. What is the minimum number of countries required in the consortium? Are there any specific requirements regarding the geographic distribution of participants? Sorry. Lorna or Adina?
If I might take this question.
Please.
So I think when you decide on which type of action you need to apply, you need to first check the eligibility conditions for that specific topic. Because if it's a coordination and support action, you need to have at least one participant from a member state, EU member state, or an associated country. If it's a research and innovation action or an innovation action, you need to have at least 3 participants from different EU member states and or associated countries. So if you're building a big consortium, make sure that, of course, you at least meet this minimum basic criteria. And of course, after that, you need to check all the other eligibility criteria that allow the participation. We spoke earlier about restrictions as well. So there is no specific, let's say, a barrier that would prevent you to build a consortium, provided that you meet the minimum conditions for that. I hope I have answered the question.
Excellent. Thanks. And also, there are no specific requirements regarding the geographic distribution of participants as long as you fulfill the minimum requirements. So it's really about how can you best deliver on the scope on the scope and the impact of the topic. Is there official documentation regarding the blind evaluation process? The annexes mentioned on the call page are not describing what is allowed or not. And I think, Isabella, this one is for you.
Indeed, thank you. So when it comes to the official documentation, I understand also the person who is asking is also asking for guidance, and this guidance is included in the application form template for the first stage proposal, because blind evaluation will only take place for first stage proposals, and this guidance is available in the template itself. It's an extra page with information, with examples of things that are allowed or not allowed in your proposal, but you will find this template only once you start preparing your proposal. So once you decide on the topic, you start your proposal preparation process. You download this template. This is the Part B template, and there you will find guidance how to prepare the proposal in more detail.
If I may jump in for this one. Indeed, you will not find this template in the funding and tenders portal, but once you start creating your proposal in the SEP submission system, that's where you will see this template with the examples that Isabella was mentioning just earlier. So only when you start the proposal in the SEP submission system.
Excellent. So, and I would also advise you to contact your national contact points, because this is the second time that we are doing blind evaluations in health research. So there's a lot of experience already with your national contact points, but also maybe in your own institution about people who've done it before. So blind evaluations are for the first stage of two-stage evaluation. So the first stage will be blind, and then we will select the best applications, and they will be invited to submit the second stage of the application. That will be a full application, and that will not be blind. So it's only the first stage of a two-stage application that will be blind. And again, there's some experience already in health research to do that. So ask around also if you need more information. And there are also some trainings and videos available, as Isabella said. Next question, please. How is the participation of AI factories envisioned as part of the consortia or external collaboration? So I'm just checking if anyone of the panel would like to. No? So basically,
could you repeat
yes,
the question, please? Could you please repeat the question?
How is the participation of AI factories envisioned as part of the consortia or external collaboration? We will get back to you about that question, but as far as we can see, any EU-funded project will have free access to use the AI factories that we are funding in the EU. But we will get back to you for more detailed guidance about that. But thanks for the question. The addition of, next question is, the addition of the Joint Research Centre as a member of the consortium can only happen after the project is granted? Question mark. Shall we contact the JRC during proposal preparation? Who would like to? Maybe Adina? Yeah.
Thank you. So indeed, nothing prevents you from not contacting the JRC while you prepare the proposal. But indeed, if your proposal is selected for funding later on, of course, you can contact the JRC to check with the JRC whether they would be interested in being part of the project later on, but only after the granting decision has been made and you start the grant agreement preparation. But once again, nothing prevents you from contacting them beforehand while you prepare your presentation, your proposal.
Thank you very much, Adina. Very clear. Next question. So next question is, could you please elaborate on how projects should specifically address gender equality? In brackets, structural, institutional versus project content. So Hannah, this one is for you.
Thank you very much. Very important questions. Thank you for asking. Well, at the level of the consortium composition, we are requiring as one of the ranking criterion that we have a gender balance among researchers in leading position. This is changed from the work program 2025. We look at leading positions in the research teams, and in case research projects get the same assessment, the same points, the ranking criterion comes into place. This is one condition that is important to consider, and the other is the integration of gender dimension into research and innovation content that is mandatory by default, unless the topic description specifies otherwise. And there is as well in the application form in part B space where you should describe how the gender perspective or gender dimension is considered in your research, or if it's not relevant, you should explain why it is not the case. Please note that the excellence the gender dimension is an excellence criterion, so it's always considered. Thank you very much.
Thank you, Hannah. And maybe what is also very important is the gender equality plan. So could you say something about that as well?
Indeed, thank you very much. Yes, the gender equality plan eligibility criterion is here for public bodies, research organizations, and higher education establishments from 2022. And we have there 4 mandatory requirements that organizations has to fulfill to be eligible to participate in the Horizon Europe funding. This includes public document that has to be formal, published on the website of the institution and signed by the top management. There has to be specific dedicated resources and gender expertise to implement the gender equality plan, and the organization has to collect gender disaggregated data on personnel and students for establishments concerned. And then there has to be also annual reporting. Last but not least, we expect that the organizations ensure the trainings, which includes gender equality and unconsciousness bias, and this training should be aimed both at staff and decision makers. So there are also 5 recommended thematic areas, which include work-life balance and organizational culture, gender balance in leadership, gender equality in recruitment and career progressions, and integration of gender dimension and measures against gender-based violence and sexual harassment. But these thematic areas are recommended. They are not mandatory. What is most important are the mandatory requirements that I mentioned before. Please note also in regard to US developments, it might be worth checking whether the organization, in case you want to cooperate with US partners, whether they have strategy or plan that comply to these eligible mandatory to the gender equality plan's mandatory requirements. This is very important because we know now the developments are going in a way slightly against gender equality measures. So this might be very important when you think of creating the consortia.
Excellent. So thank you very much. Very detailed guidance. Thank you. So we are moving again to blind evaluations. We have as a partner the, in capitals, European Patient Organization of the diseases under study. How do we describe our impact pathway without naming it? So Isabella, this one is for you.
Thank you very much. Indeed, these questions are always a little bit, it's very specific question. And if you don't see, for example, the whole proposal, it's always very difficult to give here advice. So that's kind of to say it in the beginning. What is whenever we would give guidance for blind evaluation, we see that, of course, you cannot mention the proposal. That in the proposal you cannot mention who is behind it, so you cannot directly mention it. But then you would also have to look for this indirect identification. So explaining it this way, we give examples where you have to be careful not to avoid describing it in a way that will make it crystal clear who is behind the proposal, who is the consortium partner. But of course, if there's a way to describe it, and you can still connect it then with the impact that you want to share. This is kind of a very general advice to make it for a general description. One more point is also that the first stage, the blind evaluation, as you already mentioned, is only at the first stage proposal stage. So if the proposal will be assessed positively and then move to the second stage, the consortium and all the partners can be named, and the proposal can, of course, include the whole description of the impact. So this is very important to keep in mind, that it's the second stage also that you can still fully describe the participants and the partners. I don't know if also, Dina, a little bit maybe from your experience, if you would like to add anything, or.
No, I think you described quite well. I think indeed it is the responsibility of the consortium to hide the information concerning the identity of the partners in the specific proposal in stage one. So you need to find ways to describe in a way what you're doing without saying who you are. So I don't think I have much more to say other than what Isabella said.
Thank you very much. So we're going back to international cooperation. The question is, can researchers from South Africa apply with EU partners, or must we apply with Australia or via the SAMRC? Lorna, for you.
So the answer is that South African entities that would like to participate to a consortium can apply indeed with the EU partners. There is no need, if I interpret the question correctly, to go through the South African Medical Research Council. And I don't know what the link with Australia is in that particular question, but the short answer is yes, they can apply also directly through contacts and forming a consortium with the EU entities. And of course, if you look at the guidance for Horizon Europe, they are also eligible for funding.
Excellent. Very good. Many thanks. Then the next question. Cooperation with Israel is still ongoing? Question mark. And the answer is yes. Yeah. So maybe we can go to the next question. Next question is, could you please elaborate on Ukraine's participation in EU projects? Did I just understand correctly that they cannot participate? So many thanks for that question, because I think it's the other way around. Huh?
Yes.
Lorna, we would be really happy to have Ukrainian partners with us. So Lorna, please.
Yes, indeed. Indeed, on the contrary, they are much welcome to participate, and not specifically for this specific cluster, but you will see that in other clusters, some calls are even earmarked with a special mention for Ukraine. So they are the only restriction that applies is linked to the non-controlled areas of Ukraine, meaning, well, you can call them occupied or the ones that are where the conflict is ongoing, where legal entities here face restrictions, and this is specified in the general annexes. But for all the other parts of Ukraine, on the contrary, their inclusion in consortium is very much welcome. Mm-hmm. And they are an associated country as well, so they are, of course, for funding eligible.
Excellent. So I think we're having a bridge to the next question. And Lorna, if the entity is registered in any country, but the sanctioned one, but the owner is Russian, can we apply owner is not under sanctions and does not live in Russia?
So this has to be analyzed on a case-by-case basis, and the colleagues from the executive agencies might wish to complement, because as you know, since the adoption of the 14th and 15th sanction package, there is a requirement to check the global ownership of companies. The simple fact of nationality, of being or not being on the sanctioned list, is not sufficient anymore. You have to really check who is benefiting from this, who's the ultimate owner. So this requires really a check, which we would recommend to carefully assess before including such an entity in your consortium. But let me just reread again the question for a second, in case I missed something, because I have Slido open. So sorry if I'm not looking at the camera. Yeah, I would say it's really on a case-by-case basis. In theory, it could apply, but it's a bit risky.
Adina, would you like to add, or this is okay?
No, I do not wish to add anything to this. I think indeed Lorna has already answered, and we will study this on a case-by-case basis. But indeed, the piece of advice is please check the inclusion of such applicants in the consortium before you wish to submit a proposal.
Very good. So then we move to the next question. The standard application form indicates applicants need to disclose AI tools. Where in the templates do stakeholders need to address this? This is not clear. Maybe Adina, you would like to answer this.
Indeed, I think that there is some guidance in the part B of the template of the proposal. Any parts of the proposal that are generated via AI, they need to be in a way referenced in the part B of the proposal, of course, in those specific sections that you will use, where you will use AI tools to generate them. And of course, there needs to be some kind of responsibility, also an acknowledgement made by the consortium. So those parts of the proposal, part B, that you will generate via AI tools, please check them and please put, let's say, an acknowledgement there that they have been generated via such tools. It will depend on where exactly you will be needing them to be referenced. The Part B template is quite extensive. It's divided into several sections. So please check the instructions first, and then don't forget that you need to make such references indeed.
Mm-hmm. Thank you for the question. Very important question. Next question is, can you elaborate what is meant by, in bracket and quotes, subject to restrictions for the protection of European communication networks, which in brackets an eligibility condition in few topics? I'm looking at
It's probably me.
Yes.
Yes, this is linked to Article 22, paragraph 6 of the Horizon Europe regulation. And basically what it means is that for explicitly indicated in the specific topics, so there are only a few, there are restrictions for certain suppliers. It's not a restriction for a country. It's not a restriction in the general sense. It's really applicable to specific suppliers.
Good. Next question is, can a research organisation based in the UK lead a funding application? And the answer is yes. Yes. Going to the next question. So, for GACD, which is the Global Alliance for Chronic Diseases, where India or Indian investigators can be part of the project and receive funding, question mark. Say, for example, can we have India as a study country? So these are the GACD topics, Global Alliance of Chronic Diseases, where the EU has made a commitment to fund a number of research projects. So I'm maybe checking with Lorna or Adina.
I think there is a part of the question is more linked to the topic itself, and the other is about India. So India, the government has established a co-funding mechanism that set out certain conditions to fund basically the participants and of the participation of Indian entities in consortia. But I think for the part on whether India can be a study country, if this is the object of the research, perhaps some other colleagues are best placed to answer, but I guess the answer is probably it's possible.
I would suggest that this part of the question be addressed again in the dedicated section for the destination, where this topic might be included. So please come back with this part of the question in the destination section, so that the colleague responsible could reply properly.
Excellent.
If I may complement on the funding, perhaps in case this was not clear, have a look at the dedicated guidance. You find it online on the co-funding mechanism and the countries that are covered by those. Because of course, if you are planning to include an Indian partner, which is very welcome, it's important that they on their end check that their national organizations are supporting the project as well, in case they are looking for funding. For support at the national level.
Yeah, and I think, Lorna, that is excellent advice, because once you are in a consortium, you're a family, and you all want to start together as a family. And sometimes, if you're dependent on co-funding from some other funds, then that could sometimes delay some of the projects. So good advice. Check, and we will go back to this GACD topic in destination 3. Yeah, this is destination 3 a little bit later. So can an SME from an associated member country be a coordinator of a project? And the answer is yes.
Yes.
Yeah. We very much encourage the participation of small and medium-sized enterprises. So yeah, great. Next question. Can the coordinator change from stage 1 submission to stage 2? Adina.
Yes, we do not encourage consortium changes from stage 1 to stage 2, but if this indeed would be, let's say, a circumstance that cannot be avoided, this can happen. This can be acceptable. But once again, please be reminded that changes of consortium are not encouraged from stage 1 to stage 2.
Mm-hmm. Yeah, and I think that is a good advice, because you only have maybe 3 or 4 months to submit your full stage 2 proposal. So you want to have everyone on board and get ready to go. So we have, I think, one more question to go. I see, as indicated by my colleagues here. For a project, we will leverage a previous cohort from a previous Horizon Europe project. Can we name it under the blind evaluation process? Lorna.
I think I can. No problem. I will. Indeed, the question here is with the cohorts. Of course, I assumed so. You're still if you were the project partner also in the previous Horizon Europe project, so project partner. So that's one question that would have also a impact on it. If you would like to, because if you mention the name of the cohort, and there's the linkage to you as a project partner. This, of course, you have to then assess the risk whether this can through the naming of the cohort, you as a project partner can be identified. What we also have as a general rule, if you ever mention any previous research and activities that you've taken, if they're mentioned in a neutral, from a neutral point of view, you will find this also in the guidance in the application template that we mentioned before. This should be fine, but this should be in a very neutral way. And not basically to avoid any linkage between you and as a project partner and the cohort. If you would like to highlight this linkage, then of course the cohort cannot be mentioned, because then again it's at the risk of indirect identification. So really the general rule, we have this kind of two options, whether either you want to highlight the linkage or you want to highlight the name, but then you cannot say that this connection. So, but this is again maybe better to really understand it with the examples that are also in the application template.
Excellent. I see that we need to wrap up, so I would like to thank very much our fantastic panel, Isabella, Lorna, Andrea, Hannah, Adina, and Rosanna, for being with me today. I've learned a lot. We had questions about social sciences and humanities, a lot of questions about international cooperation, blind evaluation, and many other topics. We will get back to you about the question about AI factories, and I also hope that we can discuss the question on JCD in Destination Free. With that, we are all saying goodbye to you from Brussels, and we wish you a very, very successful application process. Bye-bye.
Hello, once again, my name is Stefan Hogan, Head of Health Research at the Health and Digital Executive Agency, or HADEA. And I would like to introduce to you our next speaker, Caterina Buonocore, who is Head of Strategic Partnership Development at APRE, the Italian Agency for the Promotion of Health of European Research, which is also the lead national contact point for Italy. As such, Caterina is also the coordinator of the HNN 3.0 project, which is a network of NCPs, or national contact points, across all of Europe and a number of other countries. And this network strives to enhance the capacity of NCPs to support applicants for Horizon Europe. In a moment, Caterina will explain how the NCPs can help you apply for Horizon Europe, for instance, to find partners, to form consortia, and generally to prepare proposals. But before that, I would like to remind you to send in your questions via Slido. Questions for Caterina can be sent via the link, which is on the webpage, or the QR code. And now, Caterina, the floor is yours. So we have a small technical issue here. In a moment, we'll have Katrina speaking to you with our live presentation from the network of national contact points, which recently organized a brokerage event, and she will also tell us about that. This is just one of the ways in which the national contact points work together to help applicants find partners, form consortia, and generally prepare for Horizon Europe. Please, again, if you have questions, we've received a couple of questions already, but please go ahead. Now, hopefully, Katrina can now go live. Or not. So maybe I can fill in a bit by reminding you that there are national contact points in all EU member states and associated countries, and that includes some of the more recently associated countries, and even some third countries have national contact points. So please refer to them. You can check on the participant portal if there are national contact points for your country, and you can also select the specific area or even part of the program that they can help you with. So please bear with us. To go? No. So apparently we're still struggling with the technical aspects. But please just give us one more minute. So we're back, and our deepest apologies for the delay. We had some technical issues, and now we're ready for Caterina Buonocore's presentation of the NCP network. Please, Caterina.
Stefan, and also sorry on my side. I am here really to represent the NCP community very proudly. So thank you to DGRTD and to ADEA for having given us this space today. We are, as you see on the slide, on the first slide, this network which is really there to try to professionalize transnationally the NCP activities, our skills and services, really for the sake of a good service and a good assistance to be given to the national applicant. This project and this initiative I will present today is at its third edition. That's why it's called the HNN 3.0. Next slide, please. Before really going deeper into what we can do for applicants, I would like to really clarify what is the process of nomination, who we are. National Contact Point are really a dedicated support system created by European Commission many years ago now for Horizon Europe, and it's made of professional. I would like to underline this definition. We really focus on the assistance to our client at national level. We are hosted and nominated by single national authorities with the mission to deliver a public service free of charge and a guidance service on the framework program. So our role are described in this document. You see linked the NCP guiding principle, which is published on the website of the European Commission. You see that there is a number. We counted like a few days ago, 166 health national contact point. This means that this is a very broad network at the moment. Is made not only of European member state NCPs, but also many of the associated countries to Horizon Europe, and also non-EU countries, which we define as third countries in general. One thing I want to say of the work of an NCP, which is important for you to know, is that we are working under a confidentiality rule. So whatever you share with us in terms of science research project, be sure that we won't share it in other situations. So confidentiality is something which is really protecting, of course, you and your science. So as we said, 5 continents. We have also NCPs from newly associated countries like Canada, New Zealand, which we have met very recently. Actually, yesterday we had a meeting in Brussels with European Commission also to discuss the new calls and to understand it better, also to better help you. Next slide. We are a network dedicated to cluster health, but we have also many other networks which we want to show in these slides. In case there are also other calls which are interest for you, health has also many other calls interesting in the cluster 2 or cluster 5 or cluster 6, food and nutrition. And using this portal that you see mentioned, Horizon Europe NCP portal.eu, you can enter the different families of NCPs, and you can ask questions also to the NCPs belonging to other sectors. So on the right side of the slide, you see the 5 bullets, 1 to 5. Those are mainly the services that the NCP have to provide, from helping you to choose the right topics and the right research and innovation action or coordination action, advice on administrative procedure and contractual issues. We also do training and assistance on proposal writing, distribution of documentation, guidelines, manual, which is also something
which sometimes can give problems. Also, having the correct template in your hands before starting the work. And last point, partner search, and I will talk about it in a few minutes. Next slide, thank you. Briefly on our group, the project HNN is made by 17 entities, and I would like to show them. They are belonging to different countries, which you see on the map. Those are the bulk organization which are organizing a bit the work and the platform for all other NCPs in Europe and in the world. Next slide, thank you. So we do services for NCPs because we really need to be trained ourselves. We need to share. We need to grow together. We need to confront also sometimes our opinions and knowledge. But we also organize with this project several services and products for you, for applicants. But there is also another piece of the cake, which is really important for us, of course, the European Commission, because they are the ones who train us, but also the health-related initiatives that you see in red. The health ecosystem is very broad. You know, when you read the call and the topics, there are many actors, there are many infrastructure in the health field with whom we are establishing also formal collaborations. And there are the partnerships, the co-funded and the institutionalized. Also with them, we are trying to establish a stable collaboration so that we can inform you better on all this panorama or landscape of opportunities. Next slide, thank you. So the first service, our website. Whenever you want to look for an NCP somewhere in the world, whenever you want to have news on the health landscape, calls, event, congresses, you can use as a first door, first. So this means that on this portal we really share all the calls, not only the cluster health we will hear about today. We have a section on partnerships, so you can easily enter there and reach the different websites of the EU health-related partnership. And that's also a very important section, the one dedicated to supporting tools. I will talk about supporting tools we develop for applicants and for NCPs. Here you see there is some tutorial on the dashboard, which is also a very rich source of information when you're writing a research proposal to see who else has been funded, to search for new partners, other organizations, to extract statistics on your country participation. It's very interesting feature, the EU dashboard for Horizon Europe. Thank you. Next slide. Next slide. So yeah, this was an image of the call. You see open, closed, forthcoming. You can really then click and look. These links will bring you to the funding and tender portal or to the website, of course, of the partnership itself. So it's really a very good entry door. Next slide. Now we go to brokerage opportunities. We are contacted very often to know if we can support applicant to do partner search, to meet new colleagues. And we are very proud of this brokerage event we have organized. It was on the 5th and 6th of May. The page is, of course, active, actually more than active, as we decided to leave this platform open until actually 30th of November. And we call it long-term matching. As you see now in the platform, there are nearly 1,000 participants. If you look at the list of the countries, it's really very broad. We have a lot of also Canadian, Turkish, even African partners. There is really a broad variety of actors. And what you can do now, even if the brokerage is over, you can still enter subscribe with the cooperation profile, how we call it, describing what you want to do on what topics. You can look in the platform and ask for meetings, these people who are already registered. You can filter by topics, by country, by keywords. So it's a very effective platform for reaching out and creating new partnership. At the bottom of the slide, you see that we have created 3 small guidelines. They are all on partner search. So basically, we advise you on how to do partner search when you want to extend and expand your network, maybe through new disciplines, other countries. And the third to the right, you see it's a clinical study specific partner search tool. So in this guideline, we have inserted different ways to look for clinical partners, especially. So these are downloadable on the website, and so we would like you to read it and spread it. Next slide, thank you. So we continue a bit with supporting tools. There is more. Actually, also during this event, NCPs will in the end of the event, list all the question and answer. We call it question and answer call document, so that you can read all the questions which were answered today, and you can actually be linked to the bit of the video where this question was answered, just to make your life also a bit easier and to be more practical. Next slide. Thank you. On the supporting tool, we are also preparing this, we hope, interesting guideline. You know that in the proposal, you will have to talk about the impact you will have. There is a section dedicated to impact. There is actually a summary table in the section 2.3. And yeah, we think that's a very important part of the proposal. And we think that also many evaluators told us that they are going there to really have an overview of the project, of your results, your objectives, your key performance indicator. So we are planning to publish in, I think, 1 week, this new tool dedicated to how to compile that section. Next slide. Workshops, we also organize workshop. I want just to mention that we have organized one on the pre-commercial procurement. In this work program, I think we don't have PCP calls, but the workshop is there. Everything is recorded, the slides, so it's always accessible. We dedicate a lot of effort also to help you on the clinical study template. We actually had a webinar, and we also have a guideline, an annotated guideline on the clinical study template. I think I might have a slide also on that. Next slide, thank you. No, this is the calendar, okay, but that's also something very important. You see, this is April. So April, all the events health related are there in blue and red. The calls are basically in blue, and the event are mentioned in red. Next slide. These are, I'm really heading to the end of the presentation, but as NCP, we are really, the core of our activity is really to also show and support what is happening in the proposal, in the project, who are successful, less successful. And this is a cloud of words. Very simply, I think it's very effective because it is showing really from the top, very tiny regulatory consideration to the bottom, gender dimension, scale and significance, mitigation plan, methodological detail, interdisciplinarity. Basically, those are words extracted by the evaluation summary report that many projects have received. And if you look at this word cloud, you will actually understand what you have to think of in the project preparation. All of these elements are really important. Even the exploitation plan, it will help you to create a proposal which has really a high quality level, impact credibility. So use also this word cloud really to check and to think what you have to take care of during proposal preparation. Next slide. So the last really 5 tips from all of that word cloud, we have extracted like 5 messages. You heard, I think, also many of them in the first session dedicated also to horizontal issues. Interdisciplinarity is a must. You cannot really submit a proposal which is not enough interdisciplinary. Nowadays, you need a lot of expertise to solve these very complex challenges we are facing. And also SSH integration is a very important feature. We all advise you to really take these disciplines and these skills in consideration from the start of the project. From the moment you create the proposal, the idea, I would say, SSH disciplines are very important to guide the whole proposal through a very good impact also on society. Don't dream, make it. We read a lot of proposals that are describing, of course, their excellent idea, but many times we miss this robust and detailed methodology description. Also, evaluators are commenting a lot on that. And we are really in the data era. So data in your proposal are sacred, really important. We talk a lot about European health data space, how you will contribute to that. Verification of data that must be available, findable, and so on. And GDPR, it's also very critical. So take care of that in your proposal. Track your impact and work on its credibility. What do we mean by track your impact? It's easy to mention very broad impact, not precise, not quantified, with no indicators. We really advise you to focus on that in the impact session, but also throughout the proposal. And last message, embrace the mistakes. We know that the research journey is, of course, risky, so it's really important to identify the risks and explain the risks in the proposal and show how to mitigate in case these risks are happening. So I'm really happy to have concluded. I hope I delivered some interesting messages. And the next slide is showing the group and all our social media website. And yeah, we really wish you good luck for this call 2025. Thank you.
Thank you, Katerina, for presenting all these services and resources and advice that the NCPs can provide individually and jointly through the HNN project. Now we will go to the questions. I believe the first question has been addressed in your presentation. Is it still possible to participate in matchmaking events to meet new partners?
Yeah, indeed, Stefan. I was talking about this long matchmaking facility. So yes, this platform is still open. Actually, in these days, we have already seen virtually to give not only the coordinator, which is generally belonging to your own country, but also the other partners. So it's a nice role that, yeah, we like also to have. It's also the first meeting is an important moment to solve doubts, to structure the work. So I think it's also an important moment where the NCP won't share the content of your proposal with no other applicant.
Thank you. So confidentiality will be preserved. Where can I find a list of matchmaking events to search for consortium members in order to participate in EIC Pathfinder?
Yes, okay. Beside the fact that you can still go to our cluster health platform, because there are also many companies, there are a lot of entities that you can still contact to participate also in the EIC Pathfinder. So it's the same target. But as I showed, I think it was my second slide, there is an yes, we like to work in a way that where your legal entity is based is basically the country you should start from in the approach to the NCP. But what happens generally is that if there are other relevant partner in the NGO who are based in other countries, you can still advise that other partner to contact the NCPs, and or if you want us to see if there are any formal error in the budget or in the template, or maybe you have been using the wrong template or any other issue, you really have to send us the proposal, I would say, well in advance, because we, of course, have many contacts. So the right timing is important. So yes, but did I understand the question?
Yes,
okay.
that's answered the question. First come, first serve. Of course, within the capacities of the NCPs. Thank you very much, Katrina. We've run out of time. We will answer the other questions in writing. And again, good luck with your application process.
Thank you. Good luck.
Be your moderator for this session. And in the studio with me is Maria del Pilar González Pantaleon. Today, we will be answering your questions on the topic, improving the quality of life of persons with intellectual.
The call is today, the 22nd of May, and it's a two-stage topic, so that means that there will be a first stage. For this first stage, the deadline is the 16th of September 2025 to submit a first proposal. And then these proposals will be evaluated, and then some of them will be invited to the second stage. And the deadline for the second stage is the 16th of April 2026. The instrument of this topic is a research and innovation action with a total budget of 40 million, and the project size is between 6 and 8 million euros. The focus of this topic is human-centered on persons with long-term intellectual disabilities and their formal and informal carers, including families. Research actions under this topic can address different aspects. A first area can be properly diagnose the disease. A second area focuses on delivering medical solutions such as treatment, diagnosis, medicines, protocols, technologies, digital solutions, habilitation and rehabilitation services, or any other possible medical solution that can help preventing the worsening of the intellectual disability, reversing it if possible, or reducing its severity. A third area looks at the comorbidities or other disabilities that persons with intellectual disabilities may suffer from. A fourth area refers to transitional care for young adults with intellectual disabilities. A fifth area looks into the empowerment of persons with intellectual disabilities and their caregiver, and it's applicable with the support of assistive technologies and digital solutions. A sixth area focuses on innovative solutions for high quality and affordable care services to allow carers of persons with intellectual disabilities better balance their work and family life. And here the role played by informal and paid carers, especially family members, is very important. The 7th area concentrates on developing innovative integrated care strategies to improve the quality of life of persons with intellectual disabilities of any age. And finally, the last area of possible research is to develop guidelines in order to provide adequate support and training for caregivers, formal and informal. I would like to highlight that that applicants do not need to address all areas. You can choose some of them. In the topic is indicated that several areas need to be addressed. At least minimum has to be 3 areas that will need to be addressed. Thank you.
Thank you very much, Pilar. So I suggest now we take the first question. I have seen already 3 coming in. So may I please have the first question? Yes. The text solution, looking at the second bullet point of which you gave us a flavor before, is it compulsory to deliver technologies and digital solutions? So a similar type of question as the previous one, please.
Yes, no, it's not compulsory. Applicants can choose the medical solution that they really want to apply. And one of the samples is technologies and digital solutions, but there are others like protocols, medicine. So it's up to the applicants to choose on what they want to.
Questions coming in, please don't be shy, ask the questions. We have another one just arrived. What are the strengths and the challenges of projects that include local pilot zones and micro-production models in the evaluation phase? Are we sure that this is a question for the disabilities topic? Maybe Pilar, would you like to give it a try?
Well,
I don't think this is for us, right?
Yes.
No. So maybe let me ask a question. What is the definition of disabilities that is considered in this topic?
Well, we are looking at the ICD-11, and there we had detailed everything in the topic, and in fact we really invite applicants to read carefully everything that is in the topic test, and at the beginning we indicate what is the scope of the topic, and we have included ICD-11 with the different areas for the topic. Here, the definition, according to the ICD-11, is disorders of intellectual development are a group of etiologically diverse conditions originating during the developmental period, characterized by significantly below average intellectual functioning, approximately 2 or more standard deviations below the mean. Well, this is what appears in ICD-11, but in the topic you can really find all the links to go to the different areas. So because it's very broad, in fact, all the disease that can have an intellectual disability. So applicants need really to look into the ICD-11, the International Classification of Diseases.
Good, and I see that for the moment there are no more questions. So let me ask you a little bit of a backstage of this topic. Can you please link your topic to the political priorities of the Commission and of this Commission in particular?
Well, the Commission really, the priority is to leave no one behind. And here we really are trying not to leave no one behind, and especially persons with disabilities, and especially within this group, persons with intellectual disabilities, because sometimes it may happen that they don't have a voice. So with this topic, we really want to give them a voice, and we really want to improve their lives. And this is why we are looking also medical solutions, but also care. So there are, in this topic is broad, but it's really, our objective is really to improve the quality of life of persons with intellectual disabilities.
Good. Thank you, Pilar, for that. And also, coming back to the technologies, according to your answer, I take it that this is also the reason why you said to us both high technology or low technology can be included in the applications, in the proposals. So, and I guess this is also why we didn't mention any technology readiness level in the topic. Is this correct, Pilar?
Yes, we didn't mention any technology level readiness because it's up to the applicants to choose if they want to work on technologies, digital solutions, and at which level. So it's up to them. Maybe something, if they want something to be really on this, following the project, then maybe it can be high, but it's really up to the applicants, how they are and they want to build their proposal.
I see. Good. In the meantime, there are a couple of questions that just arrived. Let me take the second one for the moment. The first one being a bit specific, we will cover it later on. Can the project improve the quality of life, for example, through empowerment, without focusing on health? Or does there have to be a health focus aligned with the quality of life? Maybe you want to read it again. It's a bit tricky.
Yes. Well, we had mentioned in our topic, there is one of the bullet points in the scope, empowerment. But we are in the cluster of health, and so we are really trying to, of course, you can include other aspects, but being in cluster of health, we will prefer something that is through health, but of course, there is also other aspect, social aspect of care that can be taken into account. So yes, having the focus on health, but the focus can also bring other aspects to the quality of life.
Thank you, Pilar. I have here a question which might be very specific. Is dementia, for example, Alzheimer, covered in the text of a topic?
Yeah, dementia can be a comorbidity affecting persons with intellectual disabilities, but in the screening is different. Persons with intellectual disabilities and dementia are different. It may happen that persons with intellectual disabilities had dementia, and then yes, is covered. But dementia by itself, I will say no. And in fact, I will invite you to read again what it is in the ICD-11, because there is an aspect where it says intellectual disabilities borderline with dementia. So you will see what it is covered. And I really invite you to look very carefully the ICD-11 and all the footnotes with the different links to see what is included as intellectual disability.
Thank you, Pilar. I think this is a great point. And actually what you're telling us and what I'm hearing is that definitions matter a lot in this topic. So whoever wants to apply, please read carefully the text of the topic, including the footnotes, because they are so rich and they are explaining quite well the spirit of the topic. Let's see another question. Is it possible to include patients with no intellectual disability in a minor part of a proposal? Disorder where some have intellectual disability, but some not.
No, if there is not intellectual disability, is not. In fact, for example, you can see that in the scope there are 3 types of autism that can be included because they had intellectual disabilities. However, all the other types of autism are not included. So really, it had to be with intellectual disabilities.
Thank you very much, Pilar. And I think this, unfortunately, was our last question. So I would like to thank you, our speaker, for your valuable insights and for answering all the questions. I would like to thank you, attendees, for participating in this engaging session, for your time and for your questions. And we hope that you found this session valuable and informative. We wish you good luck with the preparation of your proposal. Remember, as was said in one of the previous sessions, you can ask your NCPs, you can check our participant portals and reach out to the inquiry service. And please stay with us for our next event. Thank you.
Thank you.
Thank you, Pilar.